Okay, pursuant to House Rule 10.01, I call this remote hearing of Human Services to order. Ms. Hanson, please take the roll. We can't hear you. No. Try again. Oh, I think we can hear you now.
Okay. Thank you. Good morning, members. Chair Schultz,
Present.
Vice Chair Bonner,
Present.
Lead Albright.
Morning, present.
Good morning. Representative Bolden,
Present.
Representative Burkle,
Present.
Representative Fischer,
Fischer, present.
Representative Frederick,
Present.
Representative Hanson,
Hanson, present.
Representative Keel,
Present.
Representative Liebling,
Present.
Representative Mueller,
Present.
Representative Noor,
Present.
Representative Novotny,
Present.
Representative Pearson, Representative Pinto,
Present.
Representative Rasmussen,
Rasmussen, present.
Representative Robbins, Representative Sandell,
Present.
Representative Schumacher.
Schumacher, present.
Thank you, members. Have a good weekend.
Thank you, Ms. Hanson, and we do have a quorum. Representative Bonner, would you like to move the minutes from February 10th?
Yes, Madam Chair, I'd like to move the minutes from February 10th.
Okay, members, any corrections or discussion of the minutes? Seeing none, all those in favor of the minutes, please say aye.
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 Any opposed? Okay, the motion prevails and the minutes from February 10th, 2021 are approved. So today, members, we're going to hear two bills. Both of these bills will be laid over for possible inclusion. And the first bill that we have on our docket is House File 163. So Representative Fischer, would you like to move your bill and put it in front of the committee?
Yes, Chair Schultz, I'd like to move House File 163 for consideration.
And would you
are we
like
laying
to
it
move?
over?
Would you like to move the A1 amendment?
Yes, Chair Schultz, I'd like to move the A1 amendment. This would create this is just a slight change on page 2, line 26, changing the number 275 to 310. And this was a recommendation from House Research to bring things up to date as to where we currently are.
And I think this has to do with the PCA hours. The limit was changed from 275 to 310 in a piece of legislation.
Yes,
Okay.
Chair Schultz, that is correct.
Okay, any questions about the A1 amendment from members? Not seeing any. All those in favor of the A1 amendment, please say aye.
Aye.
Any opposed? Okay, the motion is approved and the House File 163 has been amended. So do you want to speak to your bill now, Representative Fischer?
Yes, I would. Thank you, Chair Schultz, for the opportunity to present House File 163. This is to create a pilot project to help parents who are disabled in child rearing. This is a bill that was brought to me several years ago by several constituents in my district who have seen issues over the years where people who have been disabled have sometimes lost the ability to rear children because when people came in from child protective services, they felt just because you're disabled, you can't take care of a child and you don't have any support services. And so as a result, they contacted me. And so what this bill would do is establish a pilot project to assist parents who are disabled and who are child rearing. And what it would do is would take a look at a number of things in the environment, provide some extra assistance in there. And the goal is to make sure that we could keep the family unit together in these type of situations where people are disabled so that they could provide those supports. This would also require at the end a report that will come back with recommendations after the pilot project is over, is how we should be doing this going in the future so that we can keep families together. I do have several people ready to testify for me today, and I would like to turn it over to them for their stories. And I believe the first person that we will be having is Mr. Darrell Pulse.
I'm sorry, I'm having trouble hearing you, Representative Fisher.
Oh, okay, I'm sorry. Yeah,
Do
can
you want
hear
to
me?
turn it over to testifiers now
Yes,
before we
I'd
take
like to-
questions? Okay,
I'd like to turn it over to testifiers at this point. I believe Mr. Daryl Paulson will be the first one.
okay, Mr. Paulson, welcome to our committee. Please introduce yourself for the record and any affiliation you may have, and then proceed. And you're on, there you go.
Hello, Madam Chair. My name is Daryl Paulson. I come to you from the great city of Maplewood, Minnesota. I am a disabled father. I have a mustache. I have a COVID beard. I haven't shaved very much. I live my life from a power wheelchair. So good morning to every one of you. I appreciate your time and efforts on this bill. This bill was brought to our attention about 3-4 years ago when I had an incident relating to a pizza delivery guy. I don't have time to really get into that story, but we can talk about it a little bit later if there's time. But really what I wanted to say is, despite the 14th Amendment and the Olmstead Act, we in the ADA, we still don't have real protections for parents with disabilities that have a child in their home, or that have responsibilities that they have to deal with adolescent children and so forth. So I'm just going to give you a quick little data on that. In the middling data of I believe it was 2000, or it could be a little earlier than that. The ratio is, if you have a disability label in your educational record for any reason, let's say I went to special education because of my speech, or like special ed or speech class, which my daughter also does, because you have a disability label in your educational record, you're 3 to 4 times more likely to have your rights terminated, not just taken away, not just suspended, but terminated. And then you never get them back. So the reunification process is really hard after that child gets taken away. So what happened in our case is Nikki and I are both disabled. We were allowed that one visit from the county that you get after you're pregnant and you get kicked out of the hospital, right? So she's allowed that one visit, and after that one visit, they came to us and we all sat down and said, well, even though you guys aren't high-risk parents, we think you might be good for this program. So for about a year and a half, we worked with the county in a high-risk program for parents. Obviously, they didn't have any parents with disabilities in this program. That's why they asked us to. And we convinced the county that the way that my wife had to deal with our daughter was normal for us, and it was acceptable. But it took almost 2 years to do that. So in the meantime, I served clients with disabilities, and I served them very well in throughout Minnesota and a couple of cities in South Dakota. Well, what happens is I have a client that repeatedly got her kids taken away in the court level. Okay, because we stepped in, we were able to slow that process down. But once the advocate's no longer there, then that process goes 100 miles an hour, and that client doesn't ever get reunified with her child, or justice, or even understand the reason why the child was taken away to begin with. So that is why this bill is so important, and the pieces of this legislation really mean something. And so that's why we brought it to your attention. And we have another mom with a disability that would like to share her story. So if we could play that now, that would be great.
Thank you,
And
Mr.
I'll yield for
Paulson.
questions.
It looks like we have a video to play, so we'll have Ms. Fang play that video now.
Great, thank you.
Hello, my name is Summer Spica. I live in St. Paul. I use she and her pronouns. I am the mother of 4 children, ages 16, 13, 8, and 6. I have a disability, and I am also married to a man who has disabilities and depends on PCA services. Home care is an important part of our life. Without home care workers to help care for my husband, he would likely be in a facility and not be able to help care for our children or be part of our community. As much as home care brings to our life, we often think, how much more could it bring if the rules were different? For example, laundry. Most families have a laundry basket in the bathroom and they all just throw it in there, right? Well, our home care workers are not allowed to do anybody's laundry except for my husband's. That means I have to go through all of the laundry and separate it so that it is just my husband and that the PCA is washing just his clothes. That means more work for me. Empowering my husband to be able to direct his PCAs to assist with this task would greatly benefit our entire family. Having a disability doesn't mean you stop parenting. I still have a job to do, and my husband still has responsibilities as a parent. Another example would be picking kids up from school or dropping them off. As of now, I am the only person who is able to do that, and it can be a challenge with 2 full-time jobs. It would be life-changing for my husband if his PCAs could be able to go with him to drop our children off and pick them up from school or activities. It would also mean my husband could be involved in his children's activities and in our community. Having home care encompass us as a whole family would be life-changing for us. I would love to see the state look further into the challenges that parents with disabilities face, especially parents with disabilities that are people of color like my husband. We need to value people with disabilities, and that also means valuing the families that come along with them. My husband is an incredible father, and my children deserve for him to be as much a part of their life as possible. I hope that we can continue to work on this and make some real changes to the lives of families just like mine. Thank you so much for your time.
Okay, the next testifier is Nikki Villavicencio. Welcome to the committee. Please introduce yourself for the record and your affiliation.
Thank you, committee. Sorry, I'm just adjusting my audio here. My name is Nikki Villavicencio. I use she, her pronouns. I am a person with a disability and a mom. I live my life, as you can see. You know, the silver lining of COVID is that we're home doing this committee hearing, and I'm on the floor, and I have everything around me because I use my feet mostly. I'm a Filipinx woman who fights for disability rights, and I have done that for over 10 years. And I really appreciate you all considering this legislation and listening to our stories today. You know, this issue is very important to many people around the country, and I am engaged with folks around the country who are fighting for this legislation and for parents with disabilities rights. So I want to talk briefly about what this bill is and does. In a nutshell, it's a common sense approach to a proactive policy. So it supports parents with disabilities and prevents and leading to child welfare action. This legislation creates a pilot program. It establishes an advisory council, and it appropriates funding. And it also requires a report. So what the result of this legislation, we hope, is it will leave the responsibility for child rearing and decision-making in the hands of the parents. It promotes recognition of parenting capabilities with or without supports. and it reduces fear of having children removed solely based on the presence of a disability. And then also the legislation addresses sliding scale capitation based on the parent and the child's development needs. So for instance, when I had my daughter, I needed a lot more supports than now. She's 8 years old now, and she goes to public school all day. And she is actually a very big help now. But when she was a baby, I needed all kinds of help that wasn't available to me. And it really slowed down my progression of being able to do anything. And it made me realize that we have a huge gap in our supports and services for folks with disabilities. And so that's why we're here today. And we really appreciate, like I said, your time and consideration of this legislation. And Daryl and I are still here for questions or comments.
Thank you, Ms. Villavicencio. Really good to see you this morning. And thank you, Mr. Paulson, for testifying. Representative Fischer, do you have any other comments before we open it up to member questions?
Thank you, Chair Schultz. I think my presenters have done a great job of covering the topic, and we are open for questions. Thank you.
Okay, Representative Albright.
Thank you, Madam Chair. Representative Fischer, I want to personally thank you for bringing this bill forward. As I've said many, many times, this is the work that is so important because it recognizes the deficiencies in our supports for these folks. And I remark in that way because of a comment that I think it was Mr. Paulson that said, or it might have been Ms. Villavicencio, but having a disability doesn't mean that you stop parenting, or should it prevent you from being a parent. And I think it's so important, and it's really good to see both of you. You have been perennial attendees at Health and Human Services committee meetings over the last 4 terms that I've been in office, and so it's good to see your faces again, and I hope you're doing well. And I hope your daughter is doing well. I can remember when she was just a little baby, and you brought the stroller in along with yourself, and I think it just reinforces the notion, members, that this is a bill that we should rally around and support. Representative Fischer, I just sent a note to the authors to add myself as a co-author on your bill, and I would encourage the other members of this committee to do likewise. Members, we need to support this type of initiative, and I'll leave it at that.
Thank you, Representative Albright. Representative Fischer?
Thank you, Madam Chair, and thank you, Representative Albright. I very much appreciate the support. And one thing I do also want to recognize is that very early on the process, when I was approached several years ago, Representative Hamilton was a person who also helped out in getting this through and helped put together. So this has been something that, and I appreciate Representative Albright reminding me, as he was talking, that reminded me about the work that has been happening on both sides to help address this issue, because this is one of those things that everyone from across on both sides of the aisle can really see the necessity for this. So I thank you for the continued support. Look forward to continuing to move this forward.
Representative Novotny.
I would also like to thank Representative Fischer, and I would just say I'm going to try to get through this without breaking up. But as the son of a paraplegic, I know how important this is, and it's the content of the character, not the ability, not the physical ability. It goes so much farther than that. Thank you, Representative Fischer, and I will sign on also.
Thank you,
Thank you, Representative Novotny, for those comments. We appreciate your support for this bill. I have one question for Representative Fischer. I know there's the fiscal note is being developed for this bill. And so members, we can bring this bill back and go over the fiscal note before we put in our omnibus bill. Representative Robbins.
Thank you, Madam Chair and members, and thank you, Representative Fischer, and your testifiers. Just fantastic work on this by all of you. I did have one question. My understanding is that the bill requires hiring a separate PCA from a PCA who may already be serving the family to help with childcare, and I just wondered if you could speak to why that is, because it would possibly makes sense that if the family already has a great relationship with a PCA, that they might want to just employ that person for longer. So I just wondered if you could address that, but I do plan on supporting the bill and I think it's fantastic. Thank you.
Representative Fisher.
Thank you for the question. I cannot remember why it was listed as being separate. I wonder if one of my testifiers might have that.
Yes,
Yes,
we
it is a
did.
different-
Mr. Paulson.
And Nikki will be able to address that, but yes, we did fix that early on a couple years ago. What it was when we drafted the new piece to allow the Commissioner of Child Protection, we also addressed the issue of keeping the same PCA because of less disruption to the family and to the family environment. And now, when we drafted this current legislation, that got missed. But yes, that was a correction. That was the correction that the Department of DHS came up with. So they're aware that also is the case. That's our intent, to have it be the same PCA.
Ms. Villavicencio, do you have anything to add to that?
Nope, that's pretty much it in a nutshell. When we drafted the legislation, I think it was the original legislation that got put up. And so we can just offer this as an amendment, hopefully, to fix that in legislation.
Representative Fisher.
Thank you, Chair Schultz. I do know that the department had also offered some technical assistance, and I'm sure this is one of the issues that they were looking at, is making sure that we could get back to where we had it before. So we will be reaching out to the department to make sure we get that part corrected.
Okay, so since this is being laid over for possible inclusion, we can bring that back, that amendment, to take care of that issue. Representative Robbins, thank you for pointing that out.
Thank you, Madam Chair.
Any more questions from members? Okay, Representative Fisher renews his motion to have it laid over for possible inclusion in the Human Services Finance Bill. Thank you, Representative Fisher.
Thank you, Chair Schultz. Thank you, committee.
Okay, the next House file we have is House File 296. Representative Noor, would you like to move House File 296 to be heard before our committee?
Yes, Madam Chair. Good morning, Madam Chair and members. I would like to move that House File 296 be laid over for possible inclusion in the Human Services Bill.
Excellent. And it looks like you have an author's amendment. Would you like to move
Yes,
your amendment?
Madam Chair, I'd like to move A1 amendment.
Okay, the A1 amendment is before us. Would you like to describe what it is?
Madam Chair and members, the A1 amendment will eliminate parental fees for families accessing medical assistance under the home and community-based services waivers as well. Children with disabilities often move back and forth between these eligibility types, and it removes the confusion, complexity in administering the program. So this amendment aligns with the program, how the parental fees are assessed. Ask the committee to adopt the A1 amendment.
So it's my understanding, Representative Noor, that the amendment, the A1 amendment, adds home and community-based services as well as the TEPRA MA program.
That's correct, Madam Chair.
Okay, Representative Albright.
Thank you, Madam Chair. And Representative Noor, I'm in support of this initiative, but I would appreciate, and I think for the benefit of the members on the committee, if you could explain the fees and how they originate themselves and how they're duplicitous in their nature.
Representative Albright, can we take care of the amendment to get the bill and the author the shape he would like, and then talk about the underlying bill? Would that be okay?
That'd be fine. Thank you.
Okay. Any other questions just to the amendment? Seeing none, all those in favor of the A1 amendment, please say aye.
Aye.
Any opposed? Okay, the amendment is adopted. Representative Noor, would you like to describe your underlying bill before we go to questions?
Yes, Madam Chair. Madam Chair and members, the bill before you today, House File 296, as amended, will help address one of the most significant barriers facing parents of children with disabilities in Minnesota. By eliminating the parental fee for medical assistance plan services and home and community-based service waivers. The Tax Equity and Fiscal Responsibility Act, known as TEFRA, allows medical assistance eligibility for children with disabilities whose parents have too much income to qualify for medical assistance or other Minnesota healthcare programs. In order to qualify for TEFRA, a child needs to be ineligible for medical assistance when parental income is counted, live with at least one parent, be younger than 19 years old, be certified disabled by the Social Security Administration, SSA, or the State Medical Review Team, known as SMART. Need level of care to stay at home that is similar to the level of care provided in a hospital, nursing home, or ICF, intermediate care facility for people with developmental disability as determined by SMART. Finally, you have home care costs that are less than the cost of care in a medical facility. Only the child's income is counted for MA when the child is eligible for TEFRA option. The child's income limit is the same as the MA limit for a person with disability. Under TEFRA, the parent income is disregarded for children who meet the above criteria, so they can qualify for program to cover for services to grow and thrive while living at home. Members, essentially, this provides a community living setting for the child. Since 1990, families who access the option have been subjected to a sliding scale fee that have increased over time. Parents whose children access waiver must also pay a parental fee, often in hundreds or even thousands of dollars per month. In fact, I had a constituent who received a bill for $53,622.97. Can you imagine that? Having a disabled child when you're receiving a fee to pay for the services that you have received. The coverage does not end if you do not pay the fees. However, you may risk legal action, including but not limited to that the account being sent to collection. The state may take your state tax refund, garnish your wages. In fact, currently there is 2,854 accounts have been sent to the Department of Revenue for collection, and $3.4 million were uncollectible debt in fiscal year 2020. Total TEFRA collections in fiscal year 2020 was $11.7 million, which is split 50-50 between the state and the federal governments. The state $5.85 million went into the general funds as non-deductible revenue. Members, these parental fees are essentially an additional tax on parents whose children live with disabilities, a tax that they cannot afford, which places health, safety, and success of Minnesota's children at risk. The state imposition of parental fees on families of kids with disabilities does not reflect our shared values. We must prioritize and change and correct this harmful policy. Members, in fact, I used to work for the county more than 20 years ago when I used to receive the documentation for applying for TEFRA. And I will send those applications to the state to be determined by the SMART review team, which means I appreciate the initiatives that we took to reduce the paperwork, but still the fees are still harmful. So we must address collectively together to address this issue. Thank you, Madam Chair.
Thank you, Mr. Noor. So it's my understanding that last session, the fees are reduced by 15%. And I believe the fiscal note on that reduction was around $5.5 million for the biennium. And remember, members, TEFRA allows parents who do not qualify for medical assistance to cover their children who have disabilities for services. Representative Albright, if you want to hold your question, I think Ms. Pinelli can describe the fee structure for us. Ms. Pinelli?
Madam Chair, maybe what would be helpful is there's some information that was provided to me by DHS a couple of days ago in table form that shows the sliding fee scale and examples of what the fees look like. So if I can share my screen, I will show that. All right, can you see the tables?
Can you enlarge it a little bit, Ms. Pinelli?
Sure. Is that better?
That's better, thank you.
So the TEFR fees are basically, it's a sliding fee scale that starts with families who have income at or above 275% of the federal poverty guidelines, and starts at a fairly low percentage of income. I think it's around 1.6%, and then it goes up. And the people who have incomes over 975% of federal poverty guidelines income have a fee payment that I think is around 9% or so of their income per month.
Thank you, Ms. Pinelli. Representative Albright, I believe you had a question about the fees. Go ahead.
Thank you, Madam Chair. Ms. Pinelli, first off, could you expand that to 125%? My eyes aren't as good as Chair Schultz.
Sure.
Thank you. Just as an example, I'm looking at your first model there. Could you give the members an example computationally? I'm sorry if you're going to jump to a calculator, but 975% of the federal poverty guideline, what number is that?
Well, it's going to vary by family size. I could probably do a quick calculation here, just.
Well, while you're doing that, let me just expound on what I'm driving at in terms of just for that example alone. So over 975% of the federal poverty guideline, you're suggesting that in your spreadsheet here that would be an annual cost of $37,000 to the family. And so relevant to that, I understand that that could describe an independent parent or two parents with one child. Would that be correct? And it's based upon obviously their income level, but if they have a child with a debilitating in-home disability for any number of descriptions, the economic frustration is compounded by that fee. And what does that fee actually serve or service in terms of, is it an administrative fee, or is it a reaction to, well, if your income is substantially higher than the normative FPG, that we're trying to mitigate some of the costs that would otherwise be owing to you by recognizing your income? Is that what I'm seeing here?
Thank you, Representative Albright. Thank you, Ms. Pinelli. I think that is around $500,000 for a family of four, but please correct us and then maybe describe the cap on the fee if the fee is greater than the costs of providing the care, Ms. Pinelli.
Right, so the fee, and DHS staff might be able to speak to this better than I can, but the fee, it's my understanding is for the services that are provided, and you wouldn't have to pay a fee higher than the cost of the services provided, but it's basically a fee to these families that have, incomes above 275% of the federal poverty guideline to help pay for the services that are provided to their child under MA.
Thank you, Ms. Pinelli. I don't know if DHS wants to step in and provide any more information for Representative Albright. I'm not seeing that they're on. Representative Albright, did that help answer your question?
It's a tough table to really wrap my arms around in terms of what's going on here. So if anyone from DHS is listening, but not in attendance, I think I'd like to take this conversation offline with them. I don't need to belabor the point.
I think we may have Miss Bobster, Miss Bailey from DHS. Are you on?
Thank you, Madam Chair. I do have policy staff from our parental fees unit on the line, so I will pass it off to Mr. DeRose to answer that question.
Thank you, Mr. DeRose.
Good morning. Thank you, Ann, Madam Chair and members. My name is Joe Jarris. I'm the Accounting Operations Manager in the Financial Operations Division at the Department of Human Services. Representative Albright, in regards to your question, it is a sliding scale fee based on income. The higher the income, of course, the higher the fee. There is a document that the agency publishes annually, the DHS Form 2977, and that's a document that's kind of our Parental Fee 101 document. It really explains what the fee is, how it's calculated, and within that document there is a table that breaks down or gives you an idea of where the breaks are for family size by FPG. So for example, in your situation where you're wondering about a family size of 4, the 975% of the federal poverty guidelines would kick in at $255,450. So the fee in that situation, anything over 975 or any family with a income over 975 FPG has a fee of 7.49% of their adjusted gross income.
Representative Albright.
Hopefully.
Thank you, Madam Chair. I have multiple questions, but in the essence of time and brevity, if they could contact my office, I'd like to have a direct contact from them and talk about this issue.
We do have time, Representative Albright, while they're on the line, if you have more questions.
Well, if that is the case, then so recognizing and just staying with the theme of the 975%, let's say that you have an adult child in the house, and this is only requisite to children under the age of 19, is that correct?
That's correct.
Okay. And so what happens in the event where, particularly in a COVID situation, or where that income that is relevant to that FPG is lost? Is there a smoothing out on that, or how do they notify that they've lost income based upon, maybe as we reflect back upon Representative Fischer or others' initiatives where the amount of care requires one of the parents to remove themselves from the workplace? How is that affected by this?
Mr. Jarros.
Madam Chair, Representative Albright, that's a very good question. And there is actually language within statute. The governing statute is Minnesota Statute 252.27, of course. And there is a mechanism in there where families that are experiencing a loss or decrease in income can notify our agency, and we can review the fee to see if there's some relief that we can provide. The statute actually requires families to notify the agency anytime that there's not only a decrease, but also an increase in income of more than 10% from one month to the next. At that point, we'd ask that they send a letter into the agency, explain what their situation is. We would ask them for some supporting documentation. So for example, if there was a job that was lost, we'd be looking for copies of current pay stubs or a letter of separation, whether there was any severance pay. But ultimately what we'd be doing at that point is looking to see if we can then provide some relief on the fee and calculate it based on their current income as opposed to the income from their most recent federal tax return as required under statute.
Thank you, Mr. Jaros. Representative Albright.
Madam Chair, and so in the context of the fee, it's really just a recapture of the benefit, if you will, that's afforded to the families with disabled children. And so my understanding from a definitional perspective, that fee is not to handle the benefit, but really a recapture of the benefit based upon income on a sliding scale. Is that correct?
Mr. Jaros.
Madam Chair, Representative Albright. Yes, the fee is a cost sharing mechanism for the parents to participate in their child's cost of care. The receipts from the fee, or what we collect in revenue, is split with the federal government based on the federal funds participation rate, or the FMAP rate. Had been 50-50. It's changed a little bit now recently with COVID. The feds have taken on a little larger share, and the state share is deposited as non-dedicated revenue to the state's general fund. And if I may, one more comment regarding the fee, and there was a comment about a cost of service comparison. So there's a reconciliation component that exists within statute that requires our agency at the end of the state's fiscal year to compare the cost of service that was consumed by the child to what the parents were billed in a fee. So what we do at that point is we take a look to see what they were billed annually in a fee and compare that to the child's cost of service that was consumed, and they're charged the lesser of those two amounts. So the family would never be charged more than what the child actually consumes in MA services during that state fiscal year.
Thank you, Mr. Jaros. Representative Liebling, I'm sorry, Representative Albright.
We get each other. Yeah, understandably, there's sometimes a confusion between the two of us. That was meant as a joke. To the testifiers, so as an example, let me just run down on the back of a napkin. So if a family of four earns $250,000 and they have a child with a disabling situation, and that health care costs that they must bear either through private insurance or MA on an annual basis costs them, let's say, $150,000, which is not out of the stretch of the imagination, given current situations for some of our families. To maintain a household, to feed and clothe themselves, as well as to provide transportation to any number of the plethora of medical and clinical visits, you're saying that they would be obligated to pay as much as, rounding it up, $40,000 for that health care as an offset. Is that, in roundabout terms, what we're describing here?
Mr. Jaros.
Madam Chair, Representative Albright, that's absolutely correct. If the fee, based on statute, based on the sliding scale fee, if the income returns a monthly fee that annualized would be $40,000, if the child's cost of service exceeds that amount during the fiscal year, they're going to owe the full amount of the fee, which would be the $40,000.
Representative Albright.
Just a final comment. I think what this does, and this is why I'm supportive of Representative Noor's initiative, it really puts families that are struggling to really be responsible for their own circumstances, but it's penalizing them for actually trying to move ahead. Some of these healthcare costs are exorbitantly expensive, and in order to maintain the integrity of the family, in the home while providing a semblance of order for the other members of the family. I think this is an initiative that this committee should take very seriously. So thank you, Representative Noor, again for bringing it forward.
Thank you, Representative Albright, for those comments. In light of your comments, I think you should sign on to House File 11. We can expand health insurance coverage to families so they can also afford their health care for their family members. Representative Liebling.
Well, thank you, Madam Chair. This is a really interesting discussion and really poses kind of an interesting philosophical question for the committee and for the legislature. I mean, from what I just heard, the description, which I appreciate, this is complicated and it's good to have this and get some questions answered. So this is, I think the fee is functioning somewhat like a health insurance premium, except this is so much better than a private premium for families, because listen to what we just heard. If you're actually spending more, you would have spent more without the insurance, you get the value of what you would have spent, which is lower, rather than paying for the insurance, which is higher. If you had that when you're buying a private policy, what a great deal that would be, because there are plenty of people who, they spend a lot of money on insurance and don't get the value of it because the insurance is essentially taking the risk. Anyway, that's kind of an aside, but this is interesting. Just want to respond a bit to what Representative Albright just said about people being punished. I think we on this committee all agree. I can't imagine anyone here would disagree that if a child has disabilities, that they should get the services they need to be able to live their best life. And those can be very expensive. And the real question here for us is, do we consider this a right such that we should pay for it and just, no matter what the family's income, and just say everybody should be entitled to this and receive it? And I would argue that should be the case with healthcare generally, as the chair just alluded to. I mean, if it's punishing people, I mean, I honestly think that's a very loaded way to discuss it. If it's punishing people for having a higher income to have them contribute something, then it's punishing people who may be sick to have them pay for their health insurance because they're in a higher category and they have to buy their own health insurance. So, it's a really interesting philosophical argument. But, one of the challenges that we have here, I think, is that we did reduce the fees by 15% in the last budget. We heard the stories of families. There is no question that having a child with disabilities can be very, very expensive for families. And a lot of times, even the stuff that's covered by Medicaid doesn't even reflect all the costs. There are costs that aren't covered by Medicaid. And I too have heard from families where, they might have like sort of stacked situations where the out-of-pockets become just unbearable. So I don't think we have any philosophical difference here that we don't want families to be overwhelmed by the costs, and that we feel that the costs should be socialized to all of us. Socializing the cost of disability, socializing the cost of illness. I think that's a really appropriate thing to do. But what we will have a challenge with here is how we prioritize our budget. And, we did reduce the fees last time. And unless members want to raise more revenues, which, I think some of us would be willing to do, we're going to have to make very difficult choices about, where we put our limited funds. And I hope we're not in a situation where we're going to have to be cutting our budget instead of doing something. But I do have a question here too. And that is a question for Mr. Jarash, I think was how we pronounced it. And so we know that there is all this bad debt in the program. I don't think we've had any real explanation here of why we get the bad debt situation. And there's a lot of uncollectible bad debt. But my question is there a mechanism for families who are like the one that Representative Noor described his constituent? Is there a a way for families to appeal that, to get out from under that crushing debt, that, to plead hardship, to, any sort of relief mechanism for families that find themselves in that situation.
Mr. Jaros?
Madam Chair, Representative Leland, that's a very good question, and it's a question that we get asked very commonly by families. So thank you for bringing that up. As I mentioned, statute requires what the agency calculates as a fee. And we do the best we possibly can to make sure that the fees are calculated correctly and accurately based on the statute governing how fees need to be assessed. We do have a collection unit within the agency that does attempt to work with families once a debt becomes past due. And maybe if I can just back up just a second, just to give you a little bit more background. So the fees they're calculated on a monthly basis, but it's a monthly fee, but we annualize it. So we send them one bill at the beginning of the state's fiscal year. So let's just kind of use some simple math. Let's say their monthly fee is $100. We annualize it. We send them a bill for $1,200 in July. And that's their fee for the upcoming fiscal year. The expectation is that they pay the fee by the end of the fiscal year, which would be by June 30th. At that point, we go through our annual reconciliation process where we're comparing the cost of service that was consumed by the child to the fee. And again, in this situation, let's assume the cost of service was over $1,200, so they're going to owe the full $1,200. If they haven't paid the full $1,200 at that point, there's generally about a month or two lag time between when the fiscal year ends to when we complete our entire reconciliation process. So now we're talking about a 14-month period. And at that point, it becomes past due. Our collection unit would become involved. They'll reach out to the families via phone calls and letters and see if they're able to secure payment in full or set up a workable, acceptable payment plan with them. If they are, great. If not, at that point, the collection unit would file a what's called a revenue recapture claim or a tax offset, which would, with the Department of Revenue, which would allow the agency to offset any state income or property tax refunds or any lottery winnings. And if there is no ability with the parents to come up with an acceptable payment plan, or if the family just doesn't respond to our agency's attempts to contact them, we are required under Minnesota Statute 16D to refer debts to the Minnesota Department of Revenue for them to attempt collection of the debt. So they'd be sent one final letter that basically says, look, we've tried to contact you a number of times to work with you on repayment of this debt. And if you don't respond to us within 30 days, we have to refer the debt to the Department of Revenue, and then that kicks off a whole nother string of actions that the Department of Revenue could potentially take on their end. But speaking to your other question of, is there some hardship that they can file for? Well, unfortunately, within state law, there isn't, we don't have the authority to, grant a hardship waiver for a family that calls says, we just can't afford to pay the fee. There are certain situations where, with the loss of a job, if they've got a number of other outstanding medical expenses, in addition to their parental fee, we have to follow the, kind of the hardship, I guess you could say, situations that were allowed under state law to grant relief from the fee. And unfortunately, we just can't deviate from that. So hopefully that answers your question.
Representative Liebling?
Thank you, Madam Chair. Well, so there's something I think that probably bears fixing. And Representative Noor, since you're carrying the bill, I guess I would put it on you. I'd love to see you come up with something that would help to handle that, so that when a family genuinely has an issue, that there is some relief available to them. I also do think that this program, if other than, short of just getting rid of all the parental fees, I do think there would be ways to try to continue to make the program better and more responsive to the actual costs that families have, But, I guess that it's a really a question for this of priorities for this committee and for the legislature of when a family has a high income and can afford to make a contribution, you know, whether we should ask them to do it as compared to, all the other things that we have to do in our budget and, all the needs that Minnesotans have. And, that's just a really difficult conundrum. We certainly don't want to tip any family with kids with disabilities. That in itself is a really, parents with kids with disabilities who deal with that every day. It's heroic. And we don't want to them that make their job that much harder. I think that we can all agree with that. But, how we do this, and I just think we need to be very careful about it and, make sure that if we are going to just remove all the parental fees, that is indeed the priority that we want to place over other things. We just heard another really great bill right before this, more needs that people have. So, how do we balance these out? It's a really tough one. Thank you.
Thank you, Representative Liebling. If we can't find the new revenue to fund this, maybe look at the fees and change the scale at the higher income level. So it's more graduated would be another idea, Representative Noor. But I was under the impression that if they don't provide their tax information, that the charge then would be the cost of the services and not the fee. Is that correct, Mr. Jaros?
Madam Chair, yes, that is correct. That's a subset of our population when we're talking about parental fees. Another good question. In a perfect world, when the agency requests tax information from parents, the parents comply and they provide a copy of the applicable tax return and the form that we ask them to complete to the agency that we can accurately calculate a fee. And ultimately, we'll ask them 3 times throughout the fiscal year to send in their information. And near the end of the fiscal year, we'll send one final request to them and state or identify, we've asked you 3 times for the tax information so that we can calculate a fee. However, if you do not provide the tax information to us within 30 days, we will, one, contact the Department of Revenue and attempt to obtain tax information from them. And we do have the authority within or under state law and an interagency agreement to obtain the tax information from them for fee calculation purposes. Or 2, if they do not provide the tax information to us, and if it's not available from the Department of Revenue, then we would bill them the cost of service that was consumed by their child during the fiscal year. And the subset then would be our parental usage category. So we have fee assessments and we have usage accounts. The usage accounts, those dollars or those bills can be massive. I mean, tens of thousands, hundreds of thousands of dollars. That said, we're always willing to accept the tax information from the parents to go back then and calculate their fee for that time period. So our job is not to assess and collect as much in parental fees as possible. It's to administer the program based on the laws that are governing it. And sometimes when they receive that first bill that shows $50,000, $60,000, $80,000 or whatever it is for a cost of service bill or a usage bill, that's enough to prompt their attention to then comply and send tax information. Unfortunately, sometimes it's not. And then it would continue down the collection path just like any other receivable would.
Thank you, Mr. Jaros. Representative Bonner.
Yes, thank you, Madam Chair and Representative Noor. And maybe this is for one of the testifiers. And I guess it sparked a question in my mind. I know in my own family, we have some issues around disabilities. And so we've had this issue come up in our own family. But I guess I didn't know a great deal about how the fees were structured. And it was brought up that in July, they assess for the year the amount that a family would pay. And certainly, those fees, depending on, for any family, that lump sum could be a great deal and very challenging to cover. But what I didn't hear or understand is there typically some sort of like a monthly budgeting plan or something that they have with families to help them better understand how to incorporate this into their monthly budget so that it's more spread out and it's easier to manage. I'm just curious because you mentioned that large pile of debt, and I'm trying to understand if part of it is that we have families who are getting behind and then they're not able to pay a large sum. Is it, I'm trying to better understand what's leading to that hardship and how we might be able to address it really well.
Thank you, Representative Bonner. Mr. Giles?
Madam Chair, Representative Bonner. So in response to your question, yes, we can't tell families how to budget their money. We can't tell them, this is how you need to manage your funds to make the payments. We build them up front at the beginning of the fiscal year and allow them to make it, monthly payments on it or however they want to pay that over the course of the fiscal year. So we do give them that flexibility, the ability to manage their funds accordingly, so that again, by the time the fiscal year ends, that it's paid in full. But no, we don't give them specific instructions on, how to budget, for that fee assessment. We do give them advance notice, of course, of the fee assessment for the upcoming year. Our initial request goes out in April. That's basically right after they filed their tax return for the previous year, so the tax information is readily available. That's the income that the fee is based on, and then their determination order, which notifies them of the fee for the upcoming year, goes out generally the end of May. And then the fee, of course, would then start in July. And again, if there was, any change in income, whether it's a decrease or a loss of a job, again, there is language in statute already that exists where whenever there's a decrease or increase in income from one month to the next, the families can notify us and let us know, and we'll look to see if we can provide, relief to the families. And there are some families that like paying their fee up front at the beginning of the year. They'll pay it in full. There's others that wait until the end. There's some families where they're kind of waiting towards the end of the year to see where the cost of service is going to come in because, they don't want to necessarily overpay a bunch of money to the agency and then be in a position where they're overpaid. And there is actually language that allows our agency to enter into what are called disparity payment agreements with families. And what that means is that, yes, agency, you need to calculate the initial fee based on their income from their previous year's tax return. However, if there's a gross disparity, a historical disparity between what their fee assessment is or has been and the child's historical cost of service, we can agree to accept less per month for the fiscal year, with the expectation is that we're still going to settle up with the family at the end of the fiscal year. So if, we may agree to accept less now, but at the end of the fiscal year, if the cost of service comes in higher than what the family was thinking, well, then they may have a little bit more to pay at the end of the year. But there are some mechanisms within the current statute that allow for that.
Thank you. Representative Bonner?
Thank you for that. I guess I wonder if there's also some possibility to do some more structured or recommended options for families that they could use. Certainly, just like your car insurance, right? You can pay it all up front if you wish. There's no problem with that. But there are plans that help families budget by doing more a monthly option. And maybe that's something that could be considered, or maybe if families want to wait till the end of the year, recommend that they pay 50% of what their monthly bill would be each month until the end, and then they could settle that. I wonder if there's different flexibilities or options that could help with that. And certainly, I agree with Chair Liebling and I think Representative Albright that maybe having a little bit too in some of their comments, and that maybe there's some sort of a pressure valve that we could exercise. So if families are really having challenging times or extenuating circumstances, that we can help give them some relief to be able to address those issues. Because I know that caring for a child with disabilities is already a challenge. And certainly we don't want to add any additional pressure to those families. And especially because many of those families have other children that they're caring for as well. I know that's the case in my family. And so it looks very different for each family. But I guess those are some options too that I'd love to see explored as well.
Thank you, Representative Bonner. I hope you'll work with Representative Noor on those ideas. Representative Albright.
Thank you, Madam Chair. Mr. Jaros, question. At some of these income levels, obviously, folks have an initial diagnosis that may be progressive and whatnot for their child. Two questions. One is first, maybe for the benefit of everyone on the committee, what are the handoff safety nets that are available for family and or for the individual post that age 19? But maybe even more so in the event of someone who has removed all aspects of their financial wherewithal, and they're on the verge of or need to claim bankruptcy in order to move through this and just protect whatever little else they've got left. What position does the Department of Revenue take in collecting that either current or past due debt in the event that someone does file for bankruptcy?
Thank you, Representative Albright. I don't think we have anyone from Revenue on, but Mr. Jaros, if you have the answer, please respond.
Thank you, Madam Chair. Absolutely, and Representative Albright. Yeah, I can't speak specifically for the Department of Revenue and what they would do, but I can tell you that the debt is, or this type of debt is something that we will see included in bankruptcies when individuals do file them. And ultimately what would happen is even if the debt is sent to the Department of Revenue for servicing, the debt still belongs to the Department of Human Services. So if the family files bankruptcy, the Department of Revenue would, if the notification goes to the Department of Revenue, Revenue would notify us. We'd end up, recalling the case from the Department of Revenue, and depending on what type of bankruptcy it is, we may or may not be able to file a claim with the bankruptcy court to recoup, something on behalf of the state. But again, it depends on the type of bankruptcy that they're filing.
Thank you, Mr. Jaros. Representative Albright.
Thank you, Madam Chair.
Okay, I'm not seeing any other hands up. Representative Noor, closing comments, please.
Thank you, Madam Chair. I just wanted to get a quick clarity from the department, if you'll allow me to.
Go ahead.
Thank you, Madam Chair. I just wanted to know if, a child who may have otherwise qualified for TEFRA and moves into a facility, how do we handle that? Do we pay for that program, for their services?
Mr. Jaros.
Madam Chair, Representative Noor, it depends on the type of facility. So there are certain out-of-home placements where the department is required to assess a fee. And the only thing I can speak to here is just on the parental fee side of things, just so that we're clear. But there are certain placements where the department would assess a fee. And then if it's a placement where the department is not assessing a fee, the county may be able to assess a fee, and they may be using the fee structure that's within this statute, 252.27, or they may have another fee structure or schedule that they would use, and that can vary by county across the state. But as far as costs, who's paying the cost? Well, it's, again, depending on the type of placement, there could be, there's going to be some state costs, some county costs. It's going to be a shared endeavor.
Thank you. Representative Noor.
Thank you, Madam Chair. Thank you, Mr. Jaros. So I think this speaks of the complexity of this program as we have it right now. And members, this is something I think we need to start looking into to make sure that we ease the burden on the families. I've seen some of them who have declared bankruptcy because of having, excessive fees being charged on them. It's something that I think we all need to look into and figure out how we can solve it, whether we get a waiver from federal government or other, programs that we can do. This is a moment for us to stand up with the families, especially during this difficult time when the income for many families have gone down. I know they will be adjusting and going back and forth. And I also appreciate the departments for the DHS Form 22977, which makes it easy for families to apply for the program and do their calculations so they can understand the fees that they may be assessed. So thank you so much, Madam Chair. Hope we will be looking forward to having a more robust discussion in the future. Thank you.
Thank you, Representative Noor. I'm not seeing any other questions. So Representative Noor will renew his motion to lay over House File 296 as amended. Members, with that, I will see everyone on Tuesday. You'll be receiving an email and the agenda will be posted soon. With that, we are adjourned. Thank you, members.